Namaste. Hello, friends. My name is Dr. Prashant Meshram. I'm a shoulder specialist at Apollo Jubilee Hills, Hyderabad. Today, we are going to talk about a very important topic of shoulder advanced arthritis and the surgery which is called as reverse shoulder joint replacement. We are going to learn what exactly is this form of surgery. Are you a candidate for this operation? And what is the recovery period for this particular surgery? Shoulder has more movement than any other joint in our body. The reason is, number one, it is a ball and socket type of joint. This ball is the upper part of the bone of the arm and socket is at the shoulder blade bone. So this round ball is sitting on a flat socket with a smooth gliding motion. There is maximum movement possible in the shoulder joint. There are muscles like deltoid muscle and also rotator cuff muscles which help the arm to move around easily. The function of the shoulder rotator cuff muscles is to stabilize the ball while it glides freely, and the main power is given by the deltoid. But the function of the rotator cuff muscles is to stabilize the shoulder while the arm is moving, and it is very critical for us to have normal movements of the shoulder joint. In cases of damage of the shoulder joint, as seen in severe arthritis, in people who have damage to the stabilizing shoulder rotator cuff muscles, because of which the shoulder cannot function really well and we cannot really repair the rotator cuff muscles, or people with a bad fracture which cannot be repaired back or which is not really healed nicely. In all these injuries and arthritis, if it happens in older people, we recommend a surgery called as reverse shoulder replacement or reverse shoulder arthroplasty. First, we have to understand what is a shoulder replacement, and second, we have to understand what is the reverse part of the shoulder joint replacement. So shoulder joint replacement essentially means we change or replace the damaged ball and socket of the shoulder joint with metal and plastic. Metal are fixed on the ball and the socket part of the shoulder, and in between a plastic is placed. So when the metal glides smoothly on the plastic, we are able to get pain-free movements of the shoulder. Now let's talk about what is the reverse part of the shoulder replacement. Now reverse shoulder arthroplasty essentially means that the position of the ball and socket are reversed, which means the ball of the shoulder now sits on the shoulder blade and the socket will be on the top part of the arm. Because of this exchange in the configuration, there is tightening of the shoulder joint in the outside direction, which gives enough tension to the deltoid muscle to act independent, and they do not require the rotator cuff muscles anymore for stability for the movement of the shoulder, which in simple word means that the shoulder movements are possible even without the need of rotator cuff muscles. So shoulder replacement essentially means that we change the shoulder joint with metal and plastic for smooth gliding movements, and reverse shoulder replacement means we exchange the position of the ball and the socket so that the shoulder biomechanics have improved without the need of rotator cuff muscles, and deltoid alone can do most of the movement of the shoulder without the need of support of rotator cuff tendons. So how do we decide if someone is a good candidate for reverse shoulder replacement surgery or not? First, we do a thorough clinical examination of the range of motion of the shoulder and various special tests to understand how much is the problem in the shoulder and which are the structures which are likely to be damaged. And we usually order an X-ray, MRI, and maybe a CT scan, which is required to assess the damage in the joint, the damage to the rotator cuff and other muscles and tendons. With this, we are able to basically understand the complete pathoanatomy, or what exactly is the reason for the persistent pain in the shoulder and persistent stiffness of the shoulder.
So, what to expect in the process of undergoing reverse shoulder replacement surgery?
The whole process of the operation takes about 2 hours, and in which the patients are given general anesthesia, in which they sleep, and when they wake up, everything is done. I also usually like to give regional anesthesia to numb the arm. This is mainly for the pain control for the next 24 hours just after the operation, when the worst pain is supposed to be there. Usually patients have to wait in the hospital for about 2 to 3 days so that we make sure that their general health is good and we kickstart their physiotherapy. Most of my patients undergo a formal physiotherapy program at least 2 to 3 times in a week, and they also do home-based exercises. As with any other surgery, there are a few risks involved in this operation as well, such as infection and damage to the nerves around the shoulder. So friends, if any of your loved ones, grandparents, your parents, uncles or aunties, they're suffering from shoulder pain which is just not going away, waking them up in the night, they are not able to perform their activities of daily living, and they are suffering from shoulder arthritis, a bad fracture, especially in older age, they may be a very good candidate to benefit from this revolutionary operation called as reverse shoulder arthroplasty or reverse shoulder replacement. Please do consult a shoulder specialist for further information on this, on your specific case, what is the best option surgically for your particular problem. I am at Apollo Hospital Jubilee Hills in Hyderabad to take care of your shoulder needs, and this channel is my gateway to reach out to you about the latest and the most accurate information about shoulder problems and what are the different surgeries to be done, what are the different exercises you can do. I really appreciate your support with this initiative of mine to educate more and more people about shoulder problems and to help everyone get over their pain and live the best quality of life they can have. I appreciate your support. Thank you so much.